Hello, so today we're going to look at computers in medicine. Okay, so to become obviously a doctor, you're going to need loads and loads of qualifications to be a doctor or a nurse, but also you need to be competent with technology. Okay, and technology has made a huge difference in the medical world and it is used all the time. So today you're going to describe how technology contributes to medicine. Discuss examples of how technology is used and in medicine. So I put is used in medicine, apologise for that. And investigate and discuss how nanotechnology is used in medicine as well. So that is your job today for gold. You're going to investigate how nanotechnology is used in medicine. It's not what you think, okay? So how are computers used in medicine? Well, various ways. One of the ways, okay, the industry has basically become increasingly reliant on technology to assist doctors and nurses. So there's a massive population in the world today, and there's lots and lots of illnesses that are being discovered. Like, for example, at the moment, we're in a biological warfare with COVID-19, which is a new illness and is had devastating consequences alone here in Spain, and at the moment they're trying to find a way to cure it and to prevent it, and technology will have a huge great hand in that. So computers are used for monitoring patients. So for example, as you know, with the COVID-19, for example, there have been and still are lots and lots of patients in intensive care, and they need to be monitored. Now, you cannot expect a nurse, obviously, to monitor a patient's heartbeat 24/7. So we've got a computer that does that. We have ventilators which are helping people breathe. Okay, so now obviously we're keeping patient records using computers, simple databases, well, complex databases, I should add, actually, not simple, and assisting in diagnosing patients with medical problems. Plus, there are 3D printers that are being used to print medicines and medical tools. For example, there is a boy in the UK that is fascinated with engineering and technology, and he has actually 3D printed lots of, like, you know, to put the masks on, the things that they need, the sizes. He's 3D printed loads of them. So the doctors and nurses can wear the masks more comfortably. So the study of medicine is an ever-growing subject, and I think at the moment that is very, very relevant in today's day and age. Okay, like I said, particularly with the fact that we're all stuck at home. You children have only been allowed out today. Today's Sunday. You've only been allowed out today because of obviously the COVID-19. And at the moment, all the focus and all the study of medicine is probably going on COVID-19. And not to mention the technology that is being used to help the professionals is all within relation of protecting our doctors and nurses and helping our patients. So, for example, in the UK, a number of companies that have got together that will actually create cars, and Dyson that creates household products such as Hoovers, are now creating ventilators for the hospitals. So at the moment, the study and the engineering all in medicine has changed in a matter of basically overnight, okay? So when they say the study of medicine is an ever-growing subject, I think that statement couldn't be more true today. So now, they're not replacing the professional. Technology cannot replace the professional. And again, you know, in the days of school closures because of COVID-19, the people that we need the most are doctors and nurses and various other people, okay, but particularly in the medical profession. The technology is not going to replace the doctor or the nurse, okay? So now what we're going to look at is some examples of where technology is being used in medicine, and one of them is telemedicine, okay? So now, this is actually being practiced very, very quickly and right now because of the dangers that we are facing today. So one time doctors may house visit that was obviously when, you know, the communities were probably smaller and the populations were smaller. But as we know today, for example, it would be incredibly dangerous for a doctor to have a house visit. Okay, due to the fact that that patient could be having symptoms of COVID-19, but obviously the doctor is exposed to COVID-19. Now, some people will still need to see a doctor, and that is for, you know, things that are not related to COVID-19. So as we've got a picture here, as you can see the pictures here, this person here is pregnant, so they may be worried about something, may need to speak to a doctor. Maybe this person here is probably a little bit worried about their child. So maybe their child is having some difficulties, or they've got ongoing medical issues, and they may need to talk to a doctor. And maybe this person here may need the results of a brain scan. Okay, so what some people are now doing is opting to see doctors online using video conferencing. Now, there's various reasons for that, okay, and that's not just related to COVID-19, because this was happening before the coronavirus. So countries such as Sweden apparently deal with up to 45% of their patients digitally using an app called Livy, okay? But it does not replace the surgery, and it can be used for things like, now, at times I've had to go to the GP to pick up some results and speak to a doctor. But, you know, if the option of speaking to that doctor via video conferencing was a possibility, I probably would have done that. But because I had to go in and see him, that's why I did. So if you've got problems such as diagnosing a common medical problem, such as headache, sore throat, back pain, digestive troubles, that could be done via video conferencing. And if the doctor does detect something that isn't quite right, then they would ask them to come into the surgery. Maybe inquiries about various medical issues for home treatments, post-treatment for check-ins and follow-up for chronic care. Okay, so maybe this person, you know, has had some treatments and they just need a check-in with a doctor. Well, that can be done online. Faster refill short-term medical prescriptions. So, for example, some people may have had a short-term medical prescription, but maybe they might need the treatment a bit longer, so they could just have a quick consultation with their doctor, and their doctor can say, yes, okay, we do need to extend your treatment a bit further, and here's your prescription. Now, holidays, weekends, or late night, or any other situation where regular medical care is not possible. So, for example, a child may become ill during a night, and maybe that person can actually give them advice on, you know, what's wrong with their child over video conferencing. So, for example, you know, some babies may get something like croup, which can seem very, very alarming, but actually the relief of croup can be done quite quickly and quite easily. So the patient's inability to maybe leave the house due to sickness or bad weather. Now, a lot of patients these days would have the inability to leave the house because they may be at risk. Okay, so therefore they will probably talk to a doctor using video conferencing. Now, the next example I've got for you is medical imaging. Now, this is fast, basically becoming far more sophisticated. It's fast developing. So now the most use of medical imaging used to be x-rays, okay, but now we can have scans on the brain and so on. But the broad term that covers medical imaging is basically a study of the body and diagnosis. So they would include magnetic resonance, that's an MRI scan, a CT scan and x-rays. All of these devices are controlled by computers. Okay, and they are all an emerging and developing technology. But some people have gone a bit further, and now X-ray, which has been used since the early 20th century, now uses computers, and the image adjustments basically have become clearer. So now the future of imaging is basically holography, which is really, really amazing. Okay, so they use virtual reality headsets on, with doctors, and they can now look inside the body and see any problems. And these have also been used to train doctors as well. So doctors are now, thanks to technology, are now getting very, very high quality training about what goes on inside the body. Now, this is a quote I've got here from this website, and this is a company called EcoPixel. So EcoPixel's True 3D is already in use in hospitals. The Cleveland Clinic, which is in America, is using the technology to plan and prepare for liver surgery. Pediatric surgeons, which are surgeons that perform on small children and babies, Stanford University used to plan on heart surgeries on babies missing pulmonary arteries. The technology has enabled surgeons to detect more congenital heart defects in 40% less time. So that's really, really impressive. Okay, and I think very, very, this is a real game changer right here. Now, isn't it amazing that they can actually plan the heart surgery so it can actually go quicker, and there will be less mistakes and so on. Now, 3D printing in medicine. This has actually become now 3D printing is almost becoming a current technology. They're 3D printing houses. You can 3D print a phone case. You can 3D print almost anything these days. Now, but in the medical field, it's used to produce prosthetic limbs. So prosthetic limbs are for people that may have lost, like soldiers, for example, may have lost legs or arms in warfare. And the prosthetic limbs generally take a long time to make. And very expensive. But thanks to 3D printers, they're now being made very quickly and very cheaply. Okay, so 3D printing can be used to produce these limbs that can be customized, okay, to that person, because obviously every person's different. Okay, and it allows the patient to design that corresponds directly to their needs. So, for example, some people might want to return to work and their work is fairly physical. Some people may want to return to playing their sport and they don't want to let the fact that they, have had an amputation to stop them. So, and it also creates specific organ replicas that surgeons can use to practice on when performing complicated operations. So, as you can see with the example here. But one fascinating example that I have is here. So this is Dr. Atella, and he's at Boston Children's Hospital. Now, there was a patient that was born with various medical difficulties, and this patient needed a replacement bladder. Okay, so, and this was a child needed a replacement bladder. Now, the problem is when people actually have to have a transplant, obviously they've got to wait for somebody to die, and in this case it will probably be a child that has to die, and then they'll take their organ and put that organ into that person that needs it. Now, the problem is with that is the body may reject that organ because that organ is not part of that person's body. But then they came up with all these drugs to stop that. So this person that would have a new organ would have to be pumped full of anti-rejection drugs, and their body is obviously, fighting this. And the recovery for that person, can be extremely exhausting, and that person becomes very ill, and the recovery takes a hell of a long time. So what this amazing doctor did was he took some cells from the patient, from the bladder, he grew the cells and he adapted a 3D printer and printed this person a new bladder. So then the bladder could go into that boy, and obviously the cells belong to that child, they come from that child's body, it is basically that child's bladder, and the body obviously accepted it straight away. So it was a faster recovery process, no need for anti-rejection drugs, and overall, 100% success rate, 100% success. Absolutely fabulous. So what we're going to do now is I would like you to look at the future of technology in medicine. So you're going to investigate what is nanotechnology. How is nanotechnology used in medicine? And how will nanotechnology benefit patients? What is the future of nanotechnology in medicine? And can you give an example of where nanotechnology is currently being used in medicine? Okay, so once you've completed that on a Google Doc, I'd like you to upload it as an assignment on Google Classrooms. Very best of luck.